All right, so since it's 12:03, we're going to head and get started. Hello, everyone. Thank you for coming to PRSA Pittsburgh's presentation of Agility in the Age of COVID-19, featuring Meredith Amoroso from Philips. My name is Mallory Manz. I'm on the PRSA Pittsburgh board as one of our program and co-chairs. I would like to thank everyone for attending during your lunch break today. During this session, we ask that all attendees please mute your microphones. After the discussion, we will hold some time for a Q&A. If anyone has a question for Meredith during the discussion, please submit it in the Zoom meeting chat. We will do our best to make sure Meredith and Andy can answer it. We'll only allow questions via the chat. Now, to introduce our guests for this session, I would like to start off by introducing our interviewer, Andrew Conte. Andy serves as the founding director of the Center for Media Innovation at Point Park University. He also writes the Pittsburgh Public Editor column at Next Pittsburgh. Previously, he worked as an investigative journalist and has authored several nonfiction books. Most recently, Andrew worked as an investigative reporter at the Tribune Review, where he won numerous national, state, and local awards. Welcome, Andy. Finally,
Thanks for having me.
I would like to introduce our speaker, Meredith Amoroso. With 14 years of experience under her belt, Meredith is a seasoned PR professional in the consumer product, event, entertainment, and B2B environmental and healthcare industries. Over her career, Meredith has secured stories and campaigns for brands like PetSmart, Cirque du Soleil, Simon Property Group, Huffy Bicycles, Bob Evans, Musselman's, PPG Paints, and much more. This led her to Philips, where she spent 3 years managing PR for the sleep and respiratory care business group globally. She has now shifted to a new role in Philips' global press office for Philips Connected Care businesses. Thank you, Meredith, for speaking with us today. Now, Andy, I'm going to pass the discussion off to you.
Okay, thanks, Mallory. I appreciate it. Meredith, welcome. It's nice to have you here. And what a great resume, all the way from Cirque du Soleil to Huffy Bikes.
I know.
Pretty impressive. And to our audience, it's nice to see everybody. If you guys want to show your faces, that would be fine too. We'll keep everybody muted. But what a strange, unusual time this has been for all of us. And as strange as it's been for the rest of us, Meredith, I can only imagine it's been a head turner for you. What's it been like the last several months at Philips?
Well, I'll tell you, I've certainly learned more in the past, I think, 3 months than I have in the entirety of my career altogether, both about, operating as a PR professional and about ventilators and about health tech equipment and communicating internationally. I think there's a lot to say about a learning experience like this that I know it's put us all in very interesting and in some cases not so positive spots, but it certainly has allowed me to really kind of round out my capabilities and learn a lot as I've gone along. So I'm sure a lot of us on this call are in the same boat.
Yeah, no doubt. Everybody's figuring it out as we go along, right?
Yeah.
But I think one of the keys for you was this idea that you ended up with messaging both for your local audience that you're used to, and then this international audience with a lot more attention than you're used to. So how did you balance out those two different messages?
Sure, it's a really great question. Like many of the folks on this call, I have been operating as a PR professional in Pittsburgh, starting my career with a lot of clients that are locally based. So I have what I thought to be a relatively strong relationship with local press and with the sleep and respiratory care division of Philips being based in Murraysville, so Western Pennsylvania. We had this duty to serve international purpose and to really support across the globe in all of the solutions that we provide. We're not just ventilators and respiratory care at Philips. We make handheld ultrasound, we make CT scanners, we make patient monitors, and these are shipped out to international markets all across the globe. But I felt this strong pull to also remain true and support the local business here in Western Pennsylvania to help the folks that are working here. There are folks that are working 24 hours to help meet the need, making ventilators, designing new solutions that we needed to bring to market specifically to support the pandemic. So we wanted to fulfill our duty and the international communications, both internally and externally, and with governmental properties as well, but also remain vocal in the local markets. So it was interesting to balance those two. I hadn't done a whole lot of local PR for a couple of years, and it was fun to dive back into it.
Well, could we just take a step back and have you explain a little bit about what Philips is, how it fits in with Philips Respironics, and what are some of the products and where you fit into the whole company?
Yeah, absolutely. So a lot of you may be familiar with Respironics. I saw a couple of former Bruner names pop into the Zoom chat. Respironics it was based here in Murraysville and still is. The company started way back in the 80s, and we were one of the first to commercialize continuous positive airway pressure CPAP therapy. And in 2009, Philips was really and still is on a mission to become a health IT, a health tech company. And so a lot of you might be familiar with Philips light bulbs, Philips TVs. They started shifting away from that and away from the consumer electronics into this really health-driven, health technology-driven company. And Respironics, the acquisition of Respironics in 2009 was a huge step in that direction, with the ability to produce and sell respiratory and sleep therapy equipment. So that's really where Respironics came into the Philips picture, and why we're now telling a bigger story, and why our company was so integral in the COVID-19 pandemic. We one of my focal points is the sleep and respiratory care division, but as I mentioned, our company is really heading up and spearheading different industries, such as ultrasounds, CT scanners, which have the capability to detect the COVID-19 virus while looking at a picture of the lungs. Patient monitoring, which has become increasingly important in today's day and age, when a lot of people aren't able to get in and receive the face-to-face care that they need. So when this all came about, it was apparent to us very early on that we were going to play a major role in all of this. And when the pandemic sort of started to shift from China to the West and into the US, we realized, the need for ventilators is going to skyrocket, but it's also the need for all of these other pieces of equipment, and the idea of telemedicine is not going anywhere anytime soon. So our patient monitoring capabilities, our tele-ICU capabilities, those are still really, really integral in how we, publicize it and market those. So that's a little bit about how the Murraysville branch of sleep and respiratory care fits into broader Philips. But we're really at heart a health tech company.
Well, Meredith, from when we met yesterday and talked, that my first question was, well, it's a Dutch company, right? Royal Philips. How often do you have to go to Amsterdam? And you had some more bad news from the virus, right? So.
Yeah, I'm kind of supposed to be there right now, actually. So unfortunately, I'm still in Bethel Park, Pennsylvania, but we've had some nice weather recently, so I'll deal with it.
She stayed here to be with all of you. That's exactly why she stayed here. So how did, if you could then walk us through the first few months of the pandemic, especially this year. I mean, it unfolded in many different ways, but when did it first start to get on your radar that, from your communication standpoint, that this might be a different thing that you had encountered before? Was there like one moment, or was it a progression?
I would almost say that there really wasn't one key moment. I mean, we have offices and manufacturing facilities in China, so we were really aware kind of early on that this was something that needed to be addressed. And sitting in a global press office, it wasn't just when it came to the US. We needed to make sure we were communicating both internally and externally really early on. So in late February, we actually started initiating work from home procedures with a lot of our non-essential workers, really kind of introducing specific protocols for those that did need to be in office or in hospital. So the internal communications got off to a really early start. And I think Philips did a really fantastic job of communicating to our partners, to our suppliers, to our employees, what was necessary to ensure we could kind of continue moving forward and looking at that kind of, we called a triple duty of care, which was our North Star, continuing business continuity while keeping our employees and our customers really safe. So really early on, we were issuing social media protocols and even media protocols. Andrew, you're a former journalist, an investigative journalist. The media know how to get to people. So we needed to kind of communicate to our employees.
Represent the people.
You guys know what you're doing. Yeah. So we needed to communicate to employees what was the chain of command. If they were approached by someone in the media, we wanted them to be aware of who they could speak to. Same with social media. You know, there was a lot of pride happening at Philips, not only in the ventilator industry, but worldwide. We had people who were kind of putting themselves at risk going into hospitals to fix our equipment when hospitals were, you know, a high at-risk location. So everyone was very, very proud of what they were doing, and we wanted to maintain that pride, but also balance it with ensuring that we weren't oversharing information, especially medical information. So there was a lot of internal communications that went on very early on. And the other thing that needed to take place, as I mentioned, when the shift started to happen, we knew that the demand for specific types of equipment was going to be really high. We had luckily already kind of begun ramping up some of our production in a lot of these areas early in January. And as soon as that shift took place, we knew we needed to make an additional step. So we really started ramping up production, particularly of our ventilators, of our patient monitoring equipment, very quickly. And that's what we wanted to communicate. And that's kind of where the strategy took place from an external communications perspective. How can we be very transparent and communicate what we are doing to meet the evolving needs all over the world of these pieces of medical equipment? So that was kind of our initial strategy. And that also started very early on in March, even before kind of mandated quarantines were put into place in the US.
So I would say from my perspective, as long as there's a clear pathway to get to the people you need to get to, then it's, you know, the journalists will generally try to go that pathway first. And if they're getting, you know, if they're getting feedback along the way, they generally will go that route. It's only, you know, when you don't hear somebody, then you're trying to track them down. But I'm curious how the messaging, because along with all this additional attention, there came the additional criticism. Initially it was, there are simply not enough ventilators to go around. So how did you deal with that messaging that, you know, we're gonna provide them, you know, the best we can and try to keep up with demand? How did you deal with that message first?
I mean, I think the tricky part of all of this is there's so much about preparedness in external communications and public relations, but it's extremely difficult to prepare for the complete unknown, right? So we were lucky enough to have a very clear understanding very quickly as to what steps we were taking from a manufacturing perspective to increase production. So the ability to be really transparent about that, it was all about continuous communication. So again, like I mentioned, I got a chance to connect with leadership that I usually never touch or never talk to, the highest level of leadership, and getting a chance to understand, you know, where are we prioritizing our efforts? Where are we taking steps to meet this growing global demand? And that was the easy part, in all honesty, because we knew as a company we needed to immediately take action. We needed to fulfill that, you know, that gap in accessibility to ICU ventilators. So not only did we increase production of our normal ventilator units, our hospital and home care ventilator units, but we also, and this is something I was extremely proud of. If you follow me on LinkedIn, you probably got a little annoyed with a lot of my posting, but our teams worked day and night to innovate and develop a emergency use ventilator, something that usually takes years and years of ideation and conceptualization and production. We were able to create something in just a matter of weeks that still met all the stringent medical standards, given the base that we used. So we wanted to tell that story. We wanted to talk about how our employees came together, the brilliant minds at Philips came together to create something that could fill an existing gap in accessibility to ventilators worldwide. And so we were able to produce what we call the E30 emergency use ventilator, and able to kind of talk a little bit about that as well. So it's interesting what you can do when you have access to people you don't normally have access to, and when you're able to ask the right questions. It really changes the way you can tell your stories.
And just remind everyone, we're going to take questions from the audience too. So if you have questions, you can just put them in the chat. Meredith, I'm curious in how you, in the middle of this crisis, if these were people you didn't normally deal with, how did you gain the trust of everyone in the C-suite working remotely, working from Pittsburgh, introducing yourself, and also, by the way, dealing with questions from all over the world about this, emerging crisis. How did you deal with that?
Sure. I mean, having a really strong team by my side and really strong leadership absolutely helped. I sit in what we call the global press office. So I have a lot of really, really strong communicators by my side and a really strong leader who was able to really connect those dots and who has total faith in his team. So the ability for him to, come back to me and get the answers that we were looking for as communicators, and the ability of him to connect us to that executive leadership and get those responses. And he was telling us the right questions to ask. So I say this all the time, even if you're one person, I've been there, I've been the only PR person for a company many times before. But finding ways to insert yourself into conversations, creating a team by bouncing ideas off of folks that are in different departments, by asserting yourself and introducing, making those introductions. I was lucky enough to have someone do the introductions for me, but not being afraid you're the PR person, you're that kind of liaison between the business and the public. So kind of overcoming that fear of hierarchy and being willing to take the steps to ask the right questions and make the recommendations that you feel to be the right call. I mean, there were times during this whole thing where many of us disagreed with the strategy at hand. So it was all about vocalizing what you felt to be the right call. And sometimes you would get shot down. And in some situations we were shot down, and then 2 days later, we're going to change our strategy. I think this is the right move. So you are the expert, you are the PR person. The people that are in leadership roles, they have different expertise. Being able to assert yourself and formulate teams and put yourself in the position of saying, I can talk to this executive leader. I think that's really important because it'll help you to better understand the position you and your company are in, better understand the industry that you're in, and really frame your story a little bit better as well. And I feel like I missed another part of your question, Andy, but.
I think that's great advice, that whole idea that there has to be a give and take, and that you have to feel confident about what you bring to the table, and also being aware of what everyone else does, but realizing that, these are all C-level suite, executives, but at the same time, they have you there for a reason. You have an expertise that they need. And so I think it's great that you're able to support that. The idea of a global press office, it sounds so cool. It sounds like this glass-filled office at the top of the Shard or something. But
I wish.
Not that, no, all right. On the same point, I mean, one of the things that came along with all this increased attention was some increased criticism. There was the story from ProPublica and about how U.S. taxpayers had paid for some of the research that Philips has done, and this was supposed to be ventilators that went into the U.S. stockpile, but instead, the story was that Philips was selling them abroad. Can you talk a little bit about the story and how you handled that challenge? Because it's something that emerged as a real challenge for you and your team, I think, right?
Yeah, absolutely. I mean, with any, the story just need to get told, right? So with any big story, you can tell your side as much as possible, and then the real questions are going to start coming in. That did happen with ProPublica. We work with a lot of government entities, and we were approached by them with certain questions that we transparently didn't have the answers to right away. We needed to make those connections and learn what the real answers were. So what we attempted to do was really stay in communication with them. We did our best to avoid ignoring straightforward, and just respond and say, look, we're working on that answer for you. How can we help you but to meet your deadline until we find the right answers? So I think the strategy there was communicate, just let them know we're here for them. I know my boss, who was actually quoted in that article, is based in Amsterdam, so he's 6 hours ahead, and there were times where he was on the phone with the reporter at 2 a.m. his time, 3 a.m. his time, just making sure that they felt heard. It's one of those situations where the story wasn't told the way we would have liked to tell it, but we were able to be quoted. We would rather have been part of the story than say Philips could not be reached for comment, in which case it allows them to kind of go down different paths. So by making sure that we were able to remain in contact with them, and just trying to let them feel like we wanted to help and support the story. And then from there, it's a matter of kind of mitigating. So it was a big story that received a lot of international syndication. And so our job at that point, we weren't in love with the story that was told. So our job at that point was to try to counterbalance that and to continue to tell the story that we knew to be kind of the gut of everything we were doing, the people, the initiatives that we were taking to actually meet these global demands. Our motto at Philips is innovation that improves lives, continuing innovation to improve people's lives. And now more than ever, that was relevant. So we wanted to tell that story. How are we actually working 24-hour shifts, communicating with our employees, communicating with our customers and patients all over the world? So it was about counterbalancing at that point. The story was out. We were included, which was a positive, but we wanted to balance it. So we did a lot of work on the back end to create new content, to interview employees, to get those kind of human stories, to look at some of our customers who are implementing our technologies to do new and unique things. Those are the other things that media were interested in, especially in the initial part of this pandemic. So we wanted to try to find those opportunities to balance what we felt maybe didn't 100% go our way. But it is always tough. I mean, I don't know if he was able to join the call, but we have someone in our global press office who is solely dedicated to crisis communications. And I tell him every day, I couldn't do it. I couldn't only do crisis communications. It's draining. So you have to be able to find things to do that make you proud of the work that you do, make you proud of the company you represent, and make you proud of the position that you're in. So that was kind of key for me personally during all of this. Yes, bad things happen, things that you're not in love with happen. It's not about wallowing and thinking, oh, the world is against me. It's about what strategy can I implement to make things kind of change direction and go the way I want them to go. So.
I would say from the journalist perspective too, that's one of the best things you can do is to keep those lines of communication open, that if you truly can't say anything or you need more time, let the journalist know, because you may think that they have they've got some devious plan and they've figured out their way into your company, but the reality more often is that they're trying to piece things together and they think they know the story, and especially if you see that the journalist is making a sincere attempt to understand what's going on, the more you work with them, I think the better the result would be, at least from my perspective on having worked on the other side of it. I'm curious what kind of education did you have to do for the executives at your company to help them understand why these questions were coming from ProPublica, what ProPublica was or is, and and then why how they're going to respond to the questions.
So a lot of it is something that I'm proud to say we had done really, really well at Philips even prior to this, and that's we use things like holding statements and briefing documents to really give a background prior to whether it's an interview or just kind of answering questions via email. Who are we talking to? What type of publication is ProPublica? It helps because what their agenda is, who they are serving, who they are talking to. By giving them previous articles to read, you'll understand the tone of the publication and the tone that you need to take to try to work your way into that. I really praise Steve, my manager, for his ability to kind of remain calm in the situations where he knew it wasn't necessarily coming across or wasn't necessarily being quoted the way he would have preferred, but just maintaining that rapport with the reporter was something I was really impressed with. But yeah, I think it's really as prepared as you can make the executive who's doing the talking or the individual that's acting as a spokesperson with doing the research on your end, helping them to understand, our CEO of Philips is not always as close to the ventilator business as someone that may be sitting here in Pittsburgh might be. So educating them on the details of it. I got questions on how many components are in your ventilators, and I had to do that research. So once we got some of those questions and once we were reading a lot of the articles that were coming to light, we were able to kind of compile information that may not have even been asked for to create these holding statements, these kind of pre-approved messages or guidelines for how to interact and to tell a consistent story. I think that was really critical. But Also, as I mentioned, just briefing documents, giving them a background on the reporter. I always share LinkedIn profiles. I always share Muck Rack links so that my executives can see this is the tone of this reporter. These are the articles they've written, whether they're relative to the health tech industry or not. It helps them to get a better understanding of who they're talking to.
Sometimes when I listen in on these PRSA events, I always think like, oh, journalists should be paying attention to this too. They'd figure out like what's going on and how much research is done on them as well. So yeah, exactly. Yeah, I mean, there should be more of that going on anyway. We've gotten a couple of questions via chat. One, Kristen Wishon asks about how you pivoted so quickly, even before the US government was really talking strongly about the pandemic. Philips was already out there. I think you hinted at it a little bit because you were in China, but could you explain a little bit more how you were able to turn things on so quickly and get going?
Yeah, I think having that presence in China and us seeing kind of the severity of the situation firsthand there helped to prepare us a little bit transparently. But just the idea of, we understand that there is a need beyond our customers, for stockpile preparation. So the ability for us to pivot was really kind of hands down at the direction of our operations team. And for us, from a communications perspective, the ability to pivot was again, I said this in the beginning, this was almost the easy part. The operations team did all the work, pulling together the capability to really improve and up our output, and the ability for us to tell that story came pretty naturally. So I think it's the awareness, the fact that we were able to kind of see this coming a little earlier, and just the simple fact that we had already kind of been on the verge of ramping up production for a lot of these materials anyway. So it just became about us educating ourselves as communicators to be able to tell the story of how we can meet that growing need. So I wish I had a more complicated answer, but I think we were set up from an operations perspective that made it almost the easiest part for us to pivot and tell that story.
Yeah, that's great. Brian Mealy noticed that you mentioned employee pride at Philips, and he's wondering how empowering the culture is there.
That's, I will get choked up. I know I will. That's been my favorite part of all of this. I have been lucky enough to be boots on the ground in Pittsburgh. Most of my team is based in either Boston or Amsterdam. So I'm that lucky person that got to be right in the heart of where we create these ventilators. So I was lucky enough to be able to go on site. I captured some B-roll because that's another thing I wanted to talk about here. We weren't allowed to let news crews into our facilities just due to the pandemic. So what we did was we took the initiative to capture B-roll so that we could send it out. So I got to be there for that. And I was emotional on a number of occasions, just meeting these people who you could tell were just exhausted, but didn't care. They wanted to be there. They wanted to do the work. And we even kind of did like mini interviews with some of these folks and just said, what was your first thought when you heard that ventilators were one of the most in-demand pieces of medical equipment in the world? And they said, I'm just glad to be here. I'm glad I can do my part. No one said they were scared. No one said they were, annoyed about having to work longer hours or harder. Everyone was just so proud of what they were doing. And we even saw it in our leadership. These people that, you look at as this kind of head of an industry, head of a business, and you saw them really as human. We have town halls and people were getting, I hope they're going to kill me if I say this, so I won't name names, but people were getting emotional on town halls, just talking about how their employees were stepping up to the game. And that's, again, what made it easy for us to do our job as communicators, seeing the pride. We were able to kind of pull that together and tell some human interest stories that I think, honestly, have been some of the most popular pieces of content that we put out there so far. So again, it goes back to that balance. Yes, we want to tell the business side of the story, but we also want to tell the human side of the story. People care about that as well. So just the pride is there.
And thank you for that reminder. We're talking about all this stuff in a business environment, but we've all been through so much over the last few months. Yeah. Many people more than most of us, right? There's been so much loss, and even just on the ordinary stresses that we've gone through, when you stop and you think about it, it can be overwhelming. So I don't think there's any shame in showing emotion in a town hall or talking about your employees or anywhere. So, thank you to your employees for being out there doing that work for all of us. And thank you to you for, being out there and helping tell their story and get that out. I do think that's critical. And I'm glad you mentioned the fact that you were getting video for journalists who couldn't get in there and get it. I think that's critical as well.
Yeah.
Matt Junker, he asks whether you think there's a less concern among journalists with discerning the truth of the matter rather than just a repetition of facts. So I think he's asking, do they just want to say the same facts over and over again, or are they interested in really figuring out, like, what is the nuance of, in particular, like the ProPublica story, what's the truth to the story rather than just the facts of it?
I think there's a combination of both. We are in a new day and age now where things move incredibly fast. So a lot of journalists, the deadlines went from what used to be, a week to get a story written to you now have 10 hours because they want to be the first to break it, because social media is how a lot of people get their news these days. So we're combating or battling with that, and we may not have the answer. Like I said earlier, we may not have the answer in time to meet a deadline because they want to get it out. They want to tweet the story. They want to put it on LinkedIn. And so we're really combating deadlines. And when that comes into play, there is a lot of, and you're a journalist, so I have to be careful what I say, but there's a lot of,
go ahead. It's good.
There's a lot of tendency to just say, oh, this is it, this is the story, and latch on to one piece of information. So our job as communicators is to round that out as much as possible. We follow the news. We follow particularly, the reporters and the outlets that are covering our business quite a bit, but we follow the news so that we get a sense of how they might want to tell stories. So our job is to give them enough of that story that we know they want to tell, but also ensure that we're nailing home the key points that will allow them to tell the full story. And I think for the most part, in all of this, journalists did a fantastic job. Honestly, I know there's a lot going on and being talked about, fake news, this and that, but I was actually very impressed with the way journalists were able to pivot and tell the right story. And I think local press did a really fantastic job of finding those key, organizations within Pittsburgh that were contributing to the pandemic. So I think it was a balance. I think, you have your outlets and your journalists who are looking to, I call, gotcha journalism, or who looking to make a really big splash and surprise and shock. But there were a lot of reporters out there who I worked with and who my team worked with that really wanted to better understand, why is there a gap in accessibility to ventilators? How is remote care changing the way we look at healthcare in a pandemic society? What are other, what are people doing, elective care patients, what are people who aren't experiencing COVID-19 doing to get the care that they need in this time frame? So they were asking the right questions. It wasn't all just about, let's stick it to the man, or let's get this shocking fact. They were asking really interesting questions that made me think about the way I tell my stories too. So I think it was a nice give and take.
One thing, the thing that you've mentioned several times is being deadline conscious and deadline aware for the journalist, because I know, having been on the other side, when you're dealing with the journalist is also dealing with an editor, or usually a team of editors, are saying, where's that story? Why don't you have it? We can't wait till tomorrow. I have to have it, and it's not even tomorrow any longer. It's like, I have to have it this moment, because somebody else is going to get it first. So I appreciate you mentioned that several times. Katie McSorley brings up the question of whether Philips has been collaborating with other ventilator providers like ResMed to ensure the need was met.
Yeah, I think one of the interesting things about being in a communications team, my role is primarily media relations, but the team that I work on, they were communicating with far more than just the media. I mean, we were talking to International Chamber of Commerce, the World Health Organization, Johns Hopkins Research Centers, suppliers, industry analysts, and also other vendors. I mean, if you listen to any of President Trump's briefings, he and the government were constantly communicating with not only existing healthcare, health tech, and ventilator companies, but also, GEs of the world, Dyson. So our job was to maintain communication, not just with the governments and these organizations, but also even our competitors, because we're all in the same boat right now. We had to kind of put our competitive nature aside to make sure that we were delivering solutions to the patients that needed them, the hospital systems, the health systems, the remote care facilities that needed these ventilators and these other pieces of medical equipment. So yes, absolutely. We worked very closely with our competitors and with other manufacturers that had never touched a ventilator unit in their lives. We're sharing information to be to a certain degree to be able to work together to fill the gaps. So it's a great question, and it certainly was a unique way of operating. I wasn't personally on the phone with some of our competitors and some of these other manufacturers, but I know that a lot of our comms team was, and it helped us to kind of round out our stories as well.
So Deanna Tomaselli has a great question. Like you've done great so far. It's been terrific, but what's next? She wants to know, what are you going to do for the rest of 2020, and then how do you pivot into 2021? And
yep.
When's the pandemic going to end? Can you tell us?
Yeah. I wish I could tell you when the pandemic was going to end, but I think for right now we need to realize, and I will say a term that I have said way too many times in the last 3 months, but this is kind of a new normal. Health, I work for a healthcare company, and healthcare is being looked at very differently now than it was before. So we need to shift the way we tell a story. I was just on a call this morning. We were looking at the editorial calendar that we had put together in February and realized that's out the window. We need to completely change what we do. Not only are some of these solutions not going to be launched at the same time that we thought they were, but we need to talk about them differently. We need to find ways to really heighten how we're talking about telehealth, remote care capabilities, and really find ways to, I mentioned the triple duty of care earlier. How are we making lives easier for the customers that use our solutions, for the patients that use those solutions, but also our business, because we shifted. Our ventilator business is skyrocketing, but some of our other pieces of business, we have to turn our attention to fix that, and turn our attention to making sure we're not forgetting about the other parts of the business that do need our support. So Deanna, it's a great question. And the answer is we're still figuring it out. We need to understand that people will operate differently. People are going to be wearing masks in public for a long time. How do we shift that? People are going to be thinking twice before visiting their sleep therapist, because it's more elective care. So we need to think about how journalists are covering. I think I mentioned earlier, remote monitoring capabilities have always been important, but they're more important than ever to be able to figure out what your patient is going through at home on their therapy, so that they may not have to come into the office. They can limit their ability, because a lot of the folks that we serve are experiencing respiratory insufficiency, at least in the sleep and respiratory care business. Someone who may have COPD is at a greater risk right now than someone with a normal health. So how can we enable that patient and that provider to remain in contact and continue getting access to the care that they need? And I think journalists are aware of that. And so we have to pivot on the types of stories that we're telling, and pivot on the way we're looking at our business. So not only does the business have to pivot, but we as communicators do as well. We just kind of have to remain agile and change the way we're talking about it. It's no longer just a press release. Philips launches X. We are enabling a better way of providing healthcare to our customers thanks to Y. So it's been a really interesting road, and we're still working on how to shift that editorial calendar for 2020. But the other thing I didn't even touch on is a lot of our comms strategy and process. We do a lot of pitching and press releases during trade shows and events. No more trade shows and events. We've had to shift that strategy quite a bit. We've done a lot digitally and virtually, but you don't get the opportunity to have one-on-one conversations with press that you do with some of those trade shows and events. So that strategy is shifting altogether. I'll tell you that I've been sending a lot more of what I call tickler emails and phone calls lately, just touching in with the press that I would normally see at a trade show and just saying, hey, I saw you, you and your family did X on LinkedIn. I hope all is well. So it's just a matter of, if I don't have something to pitch right away, making sure I'm maintaining that connection so that I can reach out to them when I do have a story, because I'm not seeing them at my trade shows anymore.
No, this is the new normal. Us just all getting together like this, and
Yeah.
But it's surprisingly effective. Like, I feel like I've gotten to know you pretty well through this,
Yeah,
this
2
media.
days.
Yeah, 2 days. I want to say, just to wrap up, because we are starting to run out of time, but I just want to ask you what advice you have for everyone else, your colleagues who, we're all going to be faced with new challenges, unexpected things that we, obviously didn't have to encounter before the pandemic. What advice do you have for everyone on here?
I would say the 2 biggest pieces of advice from my end are, don't always think that you know what you're doing. And that almost seems counteractive, but be willing to learn, because I kind of went into this whole thing thinking like, oh, I know how to handle this. We know how to do this. But the reality was there was a lot we had to learn. So you're asking me to talk on this call, but what I would love to do is kind of chat with everybody else and ask them what their strategies were as well. I learned a heck of a lot from my colleagues, my bosses, in how to communicate, and none of us had ever done something like this before. So the ability to kind of learn, and take this and look at it as a learning opportunity as opposed to an inconvenience has probably been my biggest takeaway. But also that I'll go back to that preparedness. You can't be prepared for the impossible, but knowing your product or your business or whatever you're promoting very well, and just having in your back pocket what are the key things that you not only want to tell, but you think and know that the media are looking for, and being prepared so that you don't have to say, thank you for your questions, reporter. I'll get back to you in 3 to 5 days once I know the answers. Having something ready that you can at least kind of respond at a high level, and making them feel heard, will at least allow you to insert yourself into the conversation. So it, both from a professional kind of operational perspective, be willing to see this as a learning opportunity, and from a planning and communications perspective, just do everything you can to prepare both yourself and whoever you are working with as a spokesperson. We're kind of past the days of we wing it to a degree, but as much as you can be prepared and as much as you can be knowledgeable about what you're talking about and what you're communicating about is going to really help.
Meredith, thanks for being so generous with your time and for giving me the opportunity to get to know you a little bit better, and for all of us to get to know you. So thank you. I'll turn things back over to Mallory.
Thank you, everyone, for joining.
All right. Thank you, Andy and Meredith, so much for today. It was very informative. Glad to hear everything. And thank you to all the attendees for coming during your lunch break to view the session. We're happy to have all of you, and we look forward to seeing you at future events. Thank you, everyone. Enjoy the rest of your day.
Bye-bye.
Thanks, everyone. Good luck.